Distinguishing between dextrocardia, a congenital positional anomaly where the heart is mirrored, and dextroposition, where the heart is displaced to the right by external factors like lung collapse or a tumor, is a classic clinical challenge. While both result in the heart being in the right chest, their ECG signatures are fundamentally different. In dextrocardia with situs inversus, that is what we usually call true dextrocardia, the heart's electrical axis is mirrored. The most striking feature is that the ECG looks upside down in the limb leads and backward in the precordial leads. In lead 1, there is global inversion. You will see an inverted P wave, negative QRS complex, and an inverted T wave. In a normal heart, this usually suggests the limb leads are accidentally swapped. Leads AVR and AVL. These effectively swap roles. The P and QRS will be positive in AVR, which is normally negative, and negative in AVL. Precordial progression V1 to V6. There is a reverse R wave progression. Instead of the R wave getting taller from V1 to V6, it starts small in V1 and disappears or stays flat towards V6 because the heart is away from the left-sided electrodes. To confirm dextrocardia and get a normal looking reading, you must perform a right-sided ECG or reverse ECG by placing the precordial leads V3R to V6R on the right side of the chest and swapping the left and right arm electrodes. In dextroposition, the heart is structurally normal, not mirrored, but has been physically pushed or pulled to the right hemithorax. Axis. The electrical axis usually remains relatively normal or shows a slight shift, but it does not show the global lead 1 inversion seen in dextrocardia. P waves in lead 1 remains upright or positive because SA node is still in its anatomical position relative to the left-right orientation. Precordial progression. Like dextrocardia, you will see low voltage or poor R wave progression in the left-sided leads V4 to V6 because the heart is physically distant from those electrodes. However, V1 and V2 might show unexpectedly high voltage as they are now closer to the bulk of the displaced heart. Here is a comparison. Lead 1 P wave inverted, negative in dextrocardia with situs inversus, upright or positive in dextroposition. Lead 1 QRS, negative inverted in dextrocardia with situs inversus, usually positive in dextroposition. AVR AVL, roles swapped, AVR is positive. Dextroposition, normal orientation. Cause in dextrocardia with situs inversus, it is congenital mirroring. In dextroposition, it is displacement as in pneumothorax, scoliosis, tumor, etc. R wave progression progressively decreases from V1 to V6. Low voltage in V4 to V6, P wave remains normal in dextroposition.